Can you guys tell me right now what you're seeing with hospitalizations in our area?
Yeah, we are certainly seeing, in the Austin area, no exception, but really across the state of Texas, a pretty significant increase in hospitalizations and new COVID cases. They have about doubled. Both of those measures have doubled in the last 2 to 3 weeks. So, we are certainly seeing a significant increase in both, and that really is due directly to the Delta variant, which is now starting to circulate more and more often in Texas. Looks like, due to looking at some of our preliminary data, looks like it is now most of the new cases in Texas are associated with that Delta variant.
I was going to say, I know last week I think we said the 4 confirmed cases, but do you think there's a lot more than that out there?
Yeah, there are. Not every case gets sequenced to determine which variant it is, and so we do a sampling of those just so we can kind of compare and see what it looks like. We're not trying to sequence every single one, but there's enough information to give us an idea of what's happening in various parts of the state, and we really are seeing more and more of those Delta variant cases when we do that sequencing.
And do you think hospitals are preparing to have more people since we are seeing more of an uptick than we've seen in the last few months?
Yeah, unfortunately, we've been here before, right? We saw the big increase in the winter time. I don't think we're going to get to that high because so many people are vaccinated now. But hospitals are well aware of this, and I expect they're making their plans as they need to be prepared, because it looks like we are, really seeing another increase in Austin and across the state.
And I know last week the Austin Travis County Health Authority had said, I think there have been 333 people who had gotten COVID and were vaccinated, but out of those is about 14 that were hospitalized, which in perspective is a very small number of people who are vaccinated who end up in the hospitals.
Right.
What have you guys been seeing with vaccinated and unvaccinated people in the hospital system?
Yeah, certainly. The hospitals don't report the vaccination status of their patients to us, so we don't have sort of a comprehensive look across the state as far as hard data goes. But I know we've been seeing, just as everybody else has, different hospitals and hospital systems reporting those numbers out, and really seems like pretty consistently, maybe 96 to even 100% in some cases of those hospitalized patients are those people who have not been fully vaccinated. So that's really who's facing the most serious consequences of this latest surge of COVID-19 in Texas. And just another reminder of how important vaccination is. Certainly no vaccine, no medical intervention is 100% effective, and we know that. It will protect the vast majority of people from even getting sick at all from COVID-19. And for those that do end up and get an infection even after vaccination, we know that infection is most likely to be much, much less serious than it is among unvaccinated people.
Yeah, I was going to say, lately we have seen a couple breakthrough cases where people who were vaccinated and then got COVID. But like you said, we're kind of learning about the efficacy still, and I guess, is it certain people that it works more in than other people, or do you just not know?
Yeah, it really depends. And so we know there are some people, older adults, for example, or people who have underlying health conditions, their immune system may just not ramp up as quickly or as well as a younger, healthier person. And so that means their body may be slower or just not as good as responding to that vaccine. And so they may be a little bit more susceptible than others. But that said, anything we can do to prime the pump, prime the immune system to be ready to fight off that infection when it sees it, it's really going to make it a lot easier for the body to fight that off without having, severe disease, ending up in the hospital, or God forbid, ending up dying.
I was going to say, what would you say to people who are like, oh, people who are vaccinated are still getting it, why would I get the vaccine?
Because it's going to keep you out of the hospital and it's going to keep you alive. That's really what it comes down to.
Yeah. What else do you think is important for people to know on this topic?
Yeah, I think that really covers a lot of it. We are starting to see, no secret, in Texas, just like the rest of the country, the Delta variant really is taking over, and it just is transmitted so much more easily, and also looks like that it can cause more severe disease. And so just really trying to redouble our efforts, remind people that vaccination is widely available. There are thousands of places across Texas people can go to be vaccinated, everywhere from their doctor's office to the corner of pharmacy, to local health departments and other public health providers, hospitals, and others. Those vaccinations are available everywhere across the state of Texas today, and we don't want people to put that off. The sooner you go get that vaccine, the sooner you're going to be protected from this Delta variant that really is starting to spread through Texas.
And obviously a lot of people, because of CDC recommendations, aren't wearing masks anymore who are vaccinated. But if someone maybe is a little nervous about it with the Delta variant or some of these breakthrough cases, would you encourage them to wear a mask if it makes them feel more comfortable?
Well, certainly. I mean, our recommendation for someone who isn't vaccinated is to wear a mask, continue doing that social distancing if you're going to be out in public, because that is the best way to protect yourself, short of getting a vaccine. And certainly people who are, perhaps immunocompromised or have other concerns like that, certainly, wearing that mask and keeping that social distance can provide a little more of a buffer to them, even beyond being vaccinated.